The city of Toronto was the epicenter for SARS during the outbreak in 2003.
In Canada's biggest city, the fight...
You get the call saying you've been exposed to a very deadly virus.
There have been now Toronto's tactics are hopefully working.
It was a scary time. There were lots of people in masks coming in and out.
We were the one hospital that really got badly hit by SARS before SARS actually had a name, dealing with something we really didn't know what it was at the beginning. The first patient who came in with SARS was placed in a private room initially. He was sitting in here.
The person I contracted SARS from, they'd come through the emergency department, so they didn't believe this person was carrying SARS. He was beside me, coughing, and I was there unprotected. You could never even possibly put yourself in that position, getting a phone call saying, you can't be around any of your family members. We're very sorry, and you're at home with your family, who you know, if you did get the virus, you've exposed now for the last 2 days, and then told, quarantine yourself.
We really didn't have a lot of support in the first few days. We did not have all the information until later in the week.
It certainly was not recognized immediately. By the time it was recognized, a number of people had already been infected, and that accounts for why so many cases occurred here in Toronto.
My husband would bring food up, and I would open the door quickly, pick it up with wearing a mask, and I kept the kids and my husband on a separate level of the house. I didn't see them at all other than through window or, watching them go to school. Took my temperature up basically as many times as I could possibly do it. When it hit 38.1, I just knew that this is it, I'd been infected, so drove myself to Mount Sinai Hospital. After the initial illness, which was devastating, it took me 2 months of recuperation and rehabilitation before I felt well enough physically and psychologically.
So hospitals have come to look like crime scenes.
There were about 375 cases confirmed. 44 people died. It was the largest cluster of SARS in North America. We learned a great deal by going through that experience. We have more funding than we used to have. Toronto Public Health has staff who are located in hospitals to give us better communication between hospitals and the Public Health Department.
Now, compared to 10 years ago, communications are so much faster. So information will move quicker, I hope, than the bacteria or bugs or the viruses. But it will happen again. These are viruses. Influenza is a virus, and every year or two it surges, or every few years, at some point it will get very severe.